Hey guys, this is Marcel Ernie with Irnieracing News. Today is March 31st, 2022. I have some news to read out to you. It is a letter from Ontario Health to family practitioners, to family doctors. So Ontario Health is sending these letters out to doctors to persuade them to get the rest of their patients vaccinated with several means, including paying the doctors. So the letters, I'll throw them on the screen if I can after. It says at the top, action required. What the person who leaked it actually removed the contact from the pictures of the emails. So I don't have the contacts, but I have the letters. So January 25th, 2022. As a primary care provider, you are the key to a successful COVID-19 vaccination campaign. Ontario Health's team of practice facilitators is happy to offer you information and supports to help you engage with your unvaccinated patients and those eligible for boosters. We can support you in several ways. Technical support to identify unvaccinated patients using Ontario Health data. So there you go. So Ontario Health is going to give doctors a list of all the patients who aren't vaccinated. Another reason the digital system is going to be against us. Patient outreach support and training for your staff so you can delegate and automate the process. Example, templates and scripts for phone calls, emails, and text messages. Wow, they're really going full in on this. Trained medical student volunteers to help you contact your patients. Resources for responding to vaccine-related questions. Connecting patients with community ambassadors, trained public health advisors in your community. Arranging an online session with you and a group of your unvaccinated patients. Our facilitators can invite patients, prepare materials, co-host the meeting so you can focus on discussion with your patients. Yeah. We are offering you a stipend of $150 for your time with this situation. And you can also bill the OHIP $34 with code KO82 group therapy. So they will pay you $150 to take your time to reach out to your unvaccinated patients. And they give you a code KO82 for group therapy that you can charge with as a doctor. To get started, please contact me via email or phone. Response is required so the ministry can update their records. Participation is not mandatory. Action is required, but it's not mandatory. And so it goes on to page 2. Answers to common questions and concerns. So this is the question Q&A. How do you get the list of unvaccinated patients to my practice? How do you get the list to my practice? Our practice facilitators can help you and your administrative staff access the list. Okay, that's the answer. I have a list of my unvaccinated patients. How do I reconcile it with the EMR? I guess EMR is what? Emergency, I don't know. Maybe you guys know. What does EMR stand for? Emergency medical response, maybe? Our practice facilitators can walk you through this process. And then the next question, I don't have time to call my patients. We have developed scripts that your administrative staff can use to call your unvaccinated patients. Next question, my staff does not have time to call patients. We have a group of trained medical student volunteers who are ready to help you call your patients. We can also train your administration staff to use a free robocall platform. Oh, great. Man, what freaking tyranny, huh? This is using, Ontario's people's tax dollars to go after and pay doctors to go after the unvaccinated patients 2 years after they obviously don't want to get it. On the administrative staff for the robocalls, we recommend you use a message like this. Hi, we are calling on behalf of Dr. X. We are reaching out because we want to do everything we can to help support you and keep you safe during the pandemic. Dr. X would like to help you to receive the COVID vaccine and help to protect you from getting sick from COVID-19 or transmitting it to others. Please call us back so we can understand any questions you may have about the COVID vaccine. Oh man. We can provide an email template that your administrative staff can use to engage your unvaccinated patients. So they're trying to make it as easy as possible for doctors to get paid and not have to do any work, to convince their patients that from the trusting doctor, your family practitioner, who we have so much trust in. So obviously this is good to get this out because it shows that if any doctor is giving you a call, you know that they have no interest in you. It's only interest in the money. Oh, I want to get an extra $200, you know. Here are some ways to bill for this work. Hi there. For a counseling phone call greater than 20 minutes, there is a payment fee of $67.75 per unit. Fee code KO13 or KO82 virtual. For counseling phone calls less than 20 minutes, there's a payment fee of $6, fee code Q007. So every call that you make that goes to a voicemail at $6. Every call that you keep over 20 minutes, so they're giving incentive to doctors. We'll pay you 70 Canadian dollars on top of the other expenses that we told we'd pay for if you make these cold calls to your patients over 20 minutes. So $70 for 20 minutes of your time, you know, it's decent. A lot more than a lot of Canadians are making. For counseling phone calls, okay, my unvaccinated patients are not interested in being vaccinated. What is the point? There's the question. We are using evidence-based approaches, including motivational interviewing and the PROTCT framework to persuade patients who need extra reassurance that they are making the right decision to receive the COVID-19 vaccine. Family physicians are crucial to this effort as they remain the most trusted source of health information for their patients. Wow, such trust in our family physicians. For 2 years, getting people like my mom who now have cancer in the ovaries, and essentially, yeah, I can't even talk about this because I'm going to try to put this on YouTube. I wonder if I can even mention that. Probably. These conversations are tiring and pointless. How can I be more effective? We are using evidence-based approaches, including the motivational interviewing and the PROTCT framework, to guide the conversation in a positive and reassuring manner. Using these techniques will help to build trust with your patient and offer a compassionate approach to making the right decision. This is pretty disturbing, huh? What they're trying to do, and how doctors will go along with this too. And you know, there's so many that have already been so complicit for 2 years. March 16th. So here's a follow-up to the same doctor via email who leaked it. March 16th, 2022. We recently contacted you to participate in the Ontario Health COVID-19 vaccine uptake program to receive help through our practice facilitators. As an experienced family physician, we value your unique understanding of primary care and would appreciate your support in helping our quality improvement team. We would like to offer you the opportunity to provide feedback through a 45-minute interview. Oh, so now they want you to talk with them, and so they can try to convince you. Is it going to be feedback or is it going to be convincing? To show you our appreciation, we will offer an honorarium through a $150 Amazon e-gift card for your time participation. Yeah, so now if you have, if you give them feedback, they'll pay you $150. Participation is completely voluntary, and you may decline to participate at any time. If you are interested in participating, kindly reply via email or contact us directly at 642, and then the rest was shrubbed out, to schedule an interview. Please let us know your availability in March 2022. And that's it. Oh. Just waiting for the sun to come back, guys. Again, it's March 31st, and felt that it was important that people to understand, get this information out. This has been going on forever. The coercion to people and the coercion to doctors. The human race, humanity, there's so much evil out there, and evil in individual people, that they will give up their own morals for money, or morals to keep their job, or morals to go to the restaurants, or morals to go to the gym. I haven't given up my morals. I have not complied. I've lost my YouTube channel, one of them anyways, and this one is a ticking time bomb. So a ticking time bomb. So make sure you guys get on Rumble and Odyssey. Just type in Irnieracing, Marcel Irnie on Rumble search or Odyssey search. Otherwise, it's rumble.com/user/Irnieracing. And Odyssey is odyssey.com/@Irnieracing. Simple stuff. Okay, I'm gonna go get some exercise. My back is killing me. I gotta get back in the gym. I might make an attempt to get across the border here in a month, in May, and go get my engine in Oregon, maybe go dabble in some racing and rider training, and then see what happens when I try to get back in Canada. I've spoke with the Border Patrol twice, and he says, from his knowledge, so this is the guy that drives up and down the border. He's in the woods. He's like a conservation officer. And he says, yes, I can get across the border. They're not going to ask me any questions besides the typical, where are you going, how long are you staying, those typical questions, not the other bullshit questions. I'm a motorcycle racer, so I would always be heading to, race at Pacific Raceway in Washington, or Portland International Raceway. And nice. But I've been semi-retired 2.5 years now. It's unfortunate. Hopefully one day we'll get back. For real. Now on the way back, I don't have the answers on that. My friend said his friends that went to the States and came back, I think it was a $65,000 or $7,000 fine they give you on the way return if you don't comply with their bullshit, like their online sign-up thing and having this bullshit passport or whatever, or testing, or all three. And then, of course, you dispute that and you're going to go to court, and hopefully you'd win in court. So that's the risk I will be taking. All right, guys, this is Marcel. We're going to head her back, and thanks. What's your name? Mac. Mac. Nice to meet you, Mac. Good to meet you. Cheers. All right, let's get back to the party.
All that matters. I wouldn't rather be anyplace else on a Saturday.
And then I might go live in the woods with my friend who's mountain man and learn how to survive. And that would be in the summer. Most beautiful time to ride. It has to be on a sunny winter day. That's why people love snow biking and sledding and going up in the woods with your side-by-side in the snow. It's just epic views of reflection. So epic. Along with epic cliffs. Yeah. Beauty. Remember how big that rock was under there, right?
It's a good sized rock under there.
Yeah. All right, Dirt Bike Survivor Man, Q-Man, June 30th. June. But every month I'm screwing up, right? I wish it was June. It's January 30th. Freedom Month. And that would be in the summer, as well as hanging out all around the BC. So anyways, I am Marcel Irnie, March 31st, 2022. Today is Thursday, and then gonna go side-by-siding on Friday. Maybe I'll do some more filming for you guys. Hope you saw my last UTV adventure. 4x4 off-road, adverse reactions report leaked. I called it for fun, making a joke of it all. And then Saturday is the Souyuz again, and Sunday is Penticton Freedom Rally. All right, guys, thanks. Hey. Hello.
Hi. Hi. Hello. Hi.